Welcome to MedTalk. Hi, my name is Janie Crane, and I'm the Executive Director for the Island Hospital Foundation. Tonight's program is part of the Well Journey Adventure, which is a week-long virtual fundraiser where we are raising funds for a new health and wellness center. The Health and Wellness Center will provide educational tools and resources that will elevate the health and vitality of our community. In an age when healthcare must be proactive, the Health and Wellness Center will enable Island Hospital to deliver on its commitment to quality care and quality outcomes, while at the same time ensuring our region's focus on quality of life. The Health and Wellness Center will also enable Island Hospital to expand its community education programs. There will be space to host classes, health screenings, support groups, and even mental health group therapy. A key feature of the Health and Wellness Center is a teaching kitchen. The teaching kitchen will empower community members to make dietary modifications through hands-on cooking demonstrations. But we need your help to make this happen. By making a donation tonight, you can ensure that the Health and Wellness Center comes to fruition for you and your neighbors and your community. Making a donation is super easy. You can click the donate button in the corner of your screen, or you can go to islandhospitalfoundation.org/welljourney. Now, before we start tonight's program, I do want to thank a few of our sponsors. In particular, I would like to thank our wellness sponsor, Marathon Petroleum. Because of the generosity of all of our sponsors, tonight's program and all of the offerings throughout the Well Journey Adventure is of no cost to you, the viewer. I would also like to thank the Anacortes School District for allowing us to film here in Broadniak Theater on the brand new stage. The filming and production is being done by the Anacortes High School broadcast team, and we are so grateful for their support and help tonight. And finally, I would like to thank our three presenters, Dr. Paul Hammer, speech pathologist Libby Lewis, and Dr. Stephen Horras. Their passion is contagious, and their expertise is a gift to our community, and I hope it's a blessing to you tonight. Now, without further ado, welcome to MedTalk.
Hello, everybody. My name is Dr. Paul Hammer. I'm a psychiatrist. And today, I'd like to talk to you about the healing power of compassion. I want to tell you a story about how I came to deeply understand this phenomenon. What I want to talk about is how, in a moment of stress, of traumatic stress, compassion can affect how we experience, perceive, and possibly avoid a traumatic stress injury. I want to tell you a story about a surgeon and a corpsman. This is Fallujah, November and December of 2004, during one of the most intense battles of that war. I happened to be there as one of the psychiatrists there, and during a lull in the battle, I witnessed something remarkable. A Humvee, much like this one, rolled up with a corpsman and 3 Marines. 2 of the Marines were fairly seriously injured, but not fatally. But the third one was seriously injured. And the surgical team immediately leapt into action, swept him into the operating room, and began to go to work on him. Meanwhile, the corpsman, having done his job, took off his helmet, unfastened his flak jacket, put his rifle down, and was able to breathe easy, finally, having done his job, and brought his Marines to Bravo Surgical Company. It wasn't too long before the surgeon came out of the OR, went up to the corpsman, and told him that the Marine that he had tried so hard to save had not survived. He died. The corpsman at that point had his helmet in his hand, and he was talking to us, and you could see him become enraged, and he just wound up as hard as he could and just slammed his helmet to the ground. At that point, the surgeon did something remarkable. He grabbed him by the scruff of his neck, which was the collar of his flak jacket, and started him marching out the door of the triage entrance, which is right there, into that parking lot that you see, which was huge. And they made laps around the parking lot, lap after lap after lap. And you could see and occasionally hear as they came by, as they talked about what they had experienced. The surgeon talked about how the round had entered in a gap in the flak jacket, almost impossibly, how it had gone into his chest, the vital organs that were injured, the amount of blood that was lost. He even described for the corpsman how remarkable it was that he was able to get a patent IV inserted into this guy given the amount of blood loss he had. It took about 45 minutes, but you could see through the body language and the gestures and the way the conversation was going that the corpsman started to visibly relax. The tense anger and frustration was starting to be relieved. And after about 45 minutes of pacing and doing lap after lap after lap around that parking lot, they came back. Corpsman wiped away the tears from his face, put on his flak jacket, put his helmet back on, fastened up the flak jacket, gathered up his rifle, and went back out to the battle to be with his Marines. You see, what happened there was interesting. The corpsman thought that he had failed because his Marine didn't survive. And what I think was important at that particular moment was that if the surgeon had not corrected that misperception, had not helped him understand what really happened at that moment, it would have become solidified in his mind as his truth, and something that could potentially haunt him later as post-traumatic stress disorder, PTSD. That troubling perception, that little piece of the puzzle, that violation of what we think is right, is called a moral injury. This is an interesting phenomenon that was written about by one of my colleagues, Bill Nash, who was also there at the same time. A lot of us were puzzled about the fact that even after people had come home and you were able to treat them and do a lot of things, they still felt guilty, they still felt bad. He built upon the work of Jonathan Shea, who worked with Vietnam veterans in the previous wars. Jonathan Shea wrote 2 books which are interesting. One is called Achilles in Vietnam, and the other one is Odysseus in America, where he talked about the difficulty with Vietnam veterans in reconciling what they believed to be right, or these violations of or spiritual injuries that he coined the term moral injury. The National Center for PTSD describes it or defines it as distressing psychological, behavioral, social, and sometimes spiritual aftermath of exposure to traumatic events or unusually stressful circumstances that occurs where people may perpetrate, fail to prevent, or witness events that contradict deeply held moral or spiritual beliefs or expectations. Most people are aware of what PTSD is and what the concept of psychological trauma is all about. They're aware that there are consequences to experiencing and witnessing the horrible events of war. But there's a deeper level of spiritual wounding that occurs with killing another human being, witnessing or committing atrocities, feeling betrayed by leadership, or even more subtle events such as the stress of having to make decisions that affect the lives of your people when only bad options are available. In the case of our friend the corpsman, his potential moral injury was his own unrealistic expectations that he would be able to do the impossible and that he could save this Marine from such a catastrophic injury. Here's the thing that's relevant to us, though. I don't think this concept of spiritual or moral injury is only about severe psychological trauma. Accidents, assaults, torture, combat, killing, horrific injuries. I think that this can come about with the little traumas and the little things that occur to us in everyday life. The little injuries that we inflict on ourselves and on each other that pile up every day by day, week by week, moment by moment. And as I've seen now, in this day and age, in 2021, with COVID and the pandemic, with arguments over politics, with civil strife, with all of the anger and frustration that's out there in the world right now, I've seen a lot of this in many of my patients. These little spiritual injuries that appear to be building up. And there's an interesting phenomena at work here. I often tell my patients that when you're in it, you can't see it. When we're in stressful situations or we're engrossed in something or really deeply into something, we often aren't aware of our own reactions. Have you ever talked to somebody who's angry? And as you're talking to them, say, "Why are you so angry?" And they come back at you saying, "I'm not angry." Clearly they are. They're not aware of it. How about talking to a teenager in love with somebody that may not be good for them? Or ever try to talk somebody out of a really stupid, great idea? They're so invested in their own thing that they can't step back and, again, see the forest for the trees. Often in those stressful moments, when we're engaged with somebody, and particularly when they're stressful or really intense, we freeze. We're unsure of what to say or do. We often react then out of our own insecurities, our own needs, our own blind spots. What do we want? What's our agenda? And we fail to see the pain that's going on in other people. That's why that surgeon's actions were so remarkable. He didn't think about his own frustration, his own pain, his own difficulty about losing a patient on the operating room table. He saw the emotional pain in a young man who really wasn't processing this correctly, and he immediately acted to relieve it. I want to tell you another story. This is my medical school, Uniformed Services University of the Health Sciences. Think of it as West Point, Naval Academy, Air Force Academy for medical school. A former Surgeon General of the Israeli Defense Force was a visiting professor when I was a student there. And our medical ethics professor asked him to come and speak at our medical ethics class. And during the time that we were in the class, we were covering the issue of dual roles. That is, what do you do when you're wearing two different hats, and what's the ethical thing to do? In our case, we were wrestling with how do we reconcile being a military officer and a physician at the same time. So we invited this former Israeli Surgeon General to our class, and they had a question and answer period. At one point, our professor was doing a sort of question answer thing, and he talked to him and he said, "Let me pose a hypothetical situation. What would you do if you're the physician at an aid station and into your aid station comes two wounded people? One is a Palestinian and the other is an Israeli soldier, and they both have exactly the same wounds. Who do you triage first?" And he said to the professor, looking at him in kind of an interesting way, "That's a stupid question and I'm not going to answer it." But what he said next has stuck with me to this day. He said, "What I will tell you is this. Always remember this. First, you're a human being. Second, you're a physician. And last, you're a military officer." I've never forgotten that, even though it happened. That class occurred over 30 years ago. And I think about that every time I think about what that surgeon did with that corpsman. The reason is that when he took that young corpsman by the scruff of his neck and was going to correct him on what he was doing and what he was thinking and marched him around the parking lot, that was done out of an abundance of love, brotherhood, and affection. He reached out with compassion as a human being, one to another, sharing the common pain of frustration, loss of a patient, failure, all of that. And what I'm here to tell you today is that when done correctly, that kind of compassionate outreach, particularly in a moment of traumatic stress, is magical. It is a magically therapeutic thing that in that particular instance was far more therapeutic than anything I could have done as a psychiatrist doing therapy or critical incident stress debriefing or anything else in that moment. It was their bond. It was their patient. They shared it. And by doing that with him, I think it was enormously effective, far more than any therapy or any other medication or anything I could have done. It beats psychotherapy and serotonin medications by a mile. So, I want to ask you, in this time of ours that we live in now, this time of pandemic, of pain, of division, of strife, of anger, who do you know that's hurting right now? Who do you know who could use some love, some friendship, a listening ear, a helping hand? Who do you know who could use some compassion? And who do you know might need some healing? Here's the big bonus for this. When you reach out in a genuine act of compassion, not only does this help your friend, your spouse, your brother, your sister, your parents, your children, your neighbor, it also helps and heals a part of your own injured humanity, that part that's being nibbled to death by ducks in this day and age. To quote the famous prayer of St. Francis, where there's hatred, let me sow love. Where there's injury, pardon. Where there's doubt, faith. Where there's despair, hope. Where there's darkness, light. And where there's sadness, joy. And if I could be so bold, I'd like to add another of my own. Where there's pain, let us sow compassion and healing. Thank you.
More than 1 million people in the United States live with Parkinson's disease. More than 10 million people worldwide. Every year in the U.S., approximately 60,000 people are diagnosed with Parkinson's. It is the second most common neurodegenerative disorder next to Alzheimer's dementia. Parkinson's disease results from a decrease in the production of the neurotransmitter dopamine, which helps control body movements. Symptoms of Parkinson's disease typically occur very slowly over time, often several years before the diagnosis is made. These symptoms may include tremors in the limbs, perhaps loss of arm swing or shorter steps when walking, a quieter voice, or difficulty with swallowing. Parkinson's reduces the range of motion of muscles and eventually reduces strength throughout the body over time, making things smaller and smaller as time goes by. Shorter steps, quieter voice, shallower breaths. While there is no cure for Parkinson's yet, there is much that can be done to slow the progression, adding years and quality to people's lives through both therapeutic medicines and exercise. As a speech pathologist, I frequently work with people with Parkinson's disease in the areas of voice and communication, airway protection, and cognition. The two symptoms I treat most frequently with Parkinson's is a quiet voice and choking when swallowing. At the foundation of voice and airway protection is respiratory muscle strength, which is what I'd like to focus on today. According to researcher Erin Silverman and her colleagues, maneuvers that require rapid activation and coordination of upper airway and chest wall musculature, such as coughing and speaking, become progressively impaired as motor dysfunction progresses through the natural course of Parkinson's disease. Let's talk first about voice. Typically, people with Parkinson's disease become aware from others that their voices are diminishing in loudness as others ask them to repeat themselves or to speak up. To the person with Parkinson's, they feel like they're speaking as they always have spoken, and to be any louder would be shouting. This is because the respiratory muscles have weakened, leaving the person with a weaker voice than is normal. The effort required for that person to increase loudness to normal levels is the same amount of effort that would be required of an unimpaired person to shout. And this is why they feel that they're shouting when they increase their loudness. How exhausted would you be if you had to shout through every conversation every day to be heard and to communicate? This is what we are often asking of people with Parkinson's disease. Now, what about airway protection? The leading cause of death associated with Parkinson's disease is aspiration pneumonia. Over 40 muscles in the mouth and throat are involved in swallowing. When these muscles are strong and healthy, swallowing happens without much thought or much effort. It's mostly a response, a reflex of the body. But with Parkinson's, the messages from the brain to these many muscles sometimes gets interrupted, or they get delayed, or perhaps they're absent completely. And this can result in substances intruding into the airway that don't belong there, which then leads to coughing, choking, aspiration, and even pneumonia. The body's designed response to airway intrusion, the cough response, requires deep breath by use of the muscles of inhalation, followed by hard expulsions of air by the use of muscles of exhalation. Both speaking loudly and coughing require the strength of the diaphragm, two sets of muscles in the ribs, and the abdominal muscles. Without exercise, these muscles will weaken, communication will become increasingly challenged, and airway protection and swallow safety will decrease. Exercising the respiratory muscles, then, is an important part of slowing the progression of Parkinson's disease and maintaining safety as well as quality of life. Numerous studies have demonstrated that when the muscles of both inhalation and exhalation are exercised, especially using resistance training, people with Parkinson's are better able to protect their airways and remain heard and understood by others in conversation. There are several ways to exercise these muscles. Speech therapists typically start with simple diaphragmatic breathing techniques designed to increase the range of motion of these muscles. The diaphragm is our primary muscle, but because it's so internal, it's difficult to feel the contraction. When we breathe from the diaphragm, the belly protrudes because that muscle is pushing the inner organs outward. You'll also feel your rib cage expand when you take a deep breath in. We then exhale by first relaxing these muscles and then engaging the second set of muscles in the rib cage to pull the rib cage closed, and we use our abdominal muscles to further push the air out of our lungs. During slow, deep diaphragmatic breaths, we increase these muscles' range of motion, which over time allows for deeper breaths, more oxygen to the body, and strong exhalations necessary for cough, for voice, and speech. Additionally, voice exercises that target loudness and good vocal quality also improve respiratory muscle strength and swallow safety. Examples include sustained phonation, which is saying and holding a vowel like ah for as long as you can, and also pitch range exercises done at a certain loudness level and again with a good quality of voice. A speech therapist can measure the loudness and the quality levels to ensure that the right targets are being met. Being able to hold a note for a long time helps to build that respiratory muscle strength, and raising and lowering pitch moves the larynx in ways that helps airway protection during swallow. Finally, the most powerful way to exercise respiratory muscles is by using a resistance trainer designed for this purpose. Within these resistant trainers are valves that require certain amounts of pressure, either from breathing in or out with enough force to release them and allow airflow. Resistance levels are increased as the person gains strength, hence continually challenging the respiratory muscles. They're used not only by people with medical conditions, but also by singers and athletes who depend on optimal breathing to enhance performance. Many such trainers are on the market and have been used in research. For people with Parkinson's or other medical conditions, it's advised that they work with a speech therapist or a respiratory therapist to ensure the proper setting of the device and advancement throughout the training. Through these exercises and others, people with Parkinson's can maintain or recover strength of muscles so vital to basic but critical functions of safety, communication, and general health. No matter what stage of the disease progression a person is in, regular exercise of expiratory muscles can, in most cases, improve quality of life. I so enjoy working with people with Parkinson's and their families. I love to see the sense of empowerment that they get when they become stronger and when they learn techniques and exercises that can help them push back against this disease. I love to see them say, you know what, Parkinson's? No, not today, not in this moment. In this moment, I'm going to push back. I have the strength to take a deep breath and use my breath for my voice, for protecting myself, and I'm going to do it. These exercises and others combat the movement dysfunction that's at the core of many common symptoms of Parkinson's. I hope that this information empowers those in the battle with Parkinson's. The rehabilitative therapists of Island Hospital are here, and we're ready to navigate this journey with you. Thank you.
Hi everyone, my name is Dr. Steve Horras. I'm a family medicine physician, and today I'm going to be talking about goal setting for wellness. Now, I believe it's first important to kind of define health versus wellness and why I think wellness is something that we should be focusing on. So, health is defined by Oxford as the state of being free from illness or injury. Now, I think this is a great idea, a great ideal perhaps to pursue, but it's a reality that I feel that my patients tend to not enjoy. And it's typically a health reality for my patients that is much more messy, circuitous, at times heartbreaking, but certainly not completely free from illness or injury. Now, wellness, Oxford goes on to say, while being somewhat of an overused pop culture term, is a condition obtained when a person achieves a level of health that minimizes the chances of becoming ill. Now, it does so by sort of focusing on more of a holistic approach to living one's life. Now, this is something that I really appreciate when it comes to working with my patients. And I think that's something that I want to focus on today for this conversation. Now, there are all sorts of how-tos with wellness, self-helps. This is how you do this is how you feel better, this is how you jump higher, this is how you lose weight. Now, lifestyle medicine is something that I ascribe to. Now, I imagine that a number of you watching today have sort of your go-tos, your literature that you look at. Now, there are sort of these 6 foundational pillars to lifestyle medicine that I personally focus on and I find to be helpful. However, when it comes to thinking about wellness and all of our journeys toward more of a well life, I find that how ought to be secondary to the why. Now, my 3-year-old Eleanor, she loves asking this question, why? In fact, she asks it all the time. Now, in fact, in this case, I think why is really the question we need to be asking ourselves when it comes to wellness. Now, I think it's a challenge because many of us have not considered why we make certain decisions. Now, I imagine that a number of you have found yourselves in your doctor's office and your doc says, gosh, that cholesterol, we really need to get that under better control. Or, your blood pressure just keeps staying elevated, that's no good. Or, the A1C, that's an important number to keep down. Hopefully your doctor's not that patronizing, but some are. Now, what really comes to my mind is, but why? My 3-year-old would continue going down that sort of pathway of whys, down a deep, dark hole. But in this case, I think it really is the right thing to be asking ourselves. So I'm going to go through that thought practice a little bit. So, yeah, doc, my blood pressure is elevated. Now, what does that mean? Well, I guess for me, there's a risk of developing a stroke in the short term and kidney failure and heart disease in the long term. And those just sound bad. Well, but why? Well, because those could affect my ability to breathe, to walk, to hike, to live my life, to function in the way that is so important to me. Even if I did survive, my ability to care for myself might be diminished. And why does that matter? It matters because I want to do the Seattle to Portland bike race with my grandchild, and I need to be in my garden this spring. Now we're getting somewhere. Now, I led this lifestyle medicine program while I was in the Air Force, and the point of this was to help people reframe their day-to-day decisions and how those impacted their overall goals and wellness. We began by sort of digging down to people's whys. Now, for some folks, it was pretty easy. There was one person who had failed the last 2 fitness tests, and If they failed another one, they would be out of the military. Now, for this person, the military was their livelihood. It had they had developed all of their skills. They didn't have any other skills. It was easy for them to say, well, I need to pass this fitness test. That's my goal because I need to keep a roof over my kid's head. I need to keep food on the table. Now, for others, it was an unexplored question. And what my job was to help them begin discovering what that value was at its core and then tie that to their big goals. Now, we had another patient who said, well, I am planning on eating a whole food, plant-based diet and exercising 30 minutes a day for at least 5 days a week because I want to hike the Annapurna circuit. Or I want to go walk the Camino in Spain. Or I want to go clubbing in Amsterdam. Now, whatever the goal, as long as the goal is there and that the why has been defined and the value has been explored, it doesn't matter. I did have a patient who said, you know, Dr. Horras, my goal is to be able to fit into my swimsuit this summer. And I said, and why is that important to you? And they said, it doesn't matter what they said. What mattered was that they had a value that they had pinned down. They had gone down and said, well, I kept asking why, and it didn't matter. This is what I wanted. Now, I think it can be challenging to begin with a large goal and feel as though you need to leap across this great chasm to get there. Now, weight loss tends to be a goal that I hear on a regular basis. Well, Doc, I know I need to shave 10, 15, 20 pounds. I know that's really important. And of course, we would have to go through that why exercise. But what matters is that there's a large goal that's tied to a person's value. And then in order to achieve that, we get to work backwards. Now, I hear the phrase, I know I need to eat more veggies. And it's true. Yeah, it's a good goal. However, achieving that goal needs and requires a little bit more of a stepping stone. So, for instance, I will challenge you to add one vegetable, plant, legume. I love legumes, the best longevity food. Add those to your diet, one of them each day for the next week. Now, if you achieve that, that is a big deal. That is not a small effort, and that is worth and needs to be celebrated. What about taking 5 minutes of your day and sitting in a quiet place and having no agenda, no cell phone, no TV, and just focusing on your breath? Gosh, that's a novel concept. No cell phone? Are you serious? Now, there are all sorts of these little goals that when we build upon them, when we have success, we begin building this foundation, this sustainable lifestyle that all of a sudden we're 30 pounds down from where we were previously, or now we have made it to our grandchild's graduation and we didn't even realize what had happened. Our whole life, our whole perspective had changed. Now, I was at a lifestyle medicine conference in 2019, and one of the presenters said, "Progress is perfection." Now, there are a lot of us who have voices in our head that say, "Well, if I don't do this perfectly, if I miss a day, then I have failed, and I might as well go and get that McDonald's hamburger," which no judgment, or that big gulp and just take it down because whatever, it doesn't matter anymore. Now, these are the ways that we sort of harm ourselves. And that's why it's so important to be celebrating each little step we are making in a positive direction on our journey toward wellness. So what I would challenge you, viewer, today to do is to consider what your whys are for wellness, to begin making goals for yourself, large and small. Thank you.
You can inspire better health for your community. If you would like to make a donation in support of Island Hospital's new Health and Wellness Center, you can do so by clicking the donate button in the corner of your screen, or go to islandhospitalfoundation.org/welljourney. And don't forget that the adventure continues tomorrow. I hope that you can join us for a class during the day or for the Great Bagel Bake-Off tomorrow evening. On behalf of the Island Hospital Foundation and our board of directors, thank you for joining us tonight. Stay well and stay safe.